So let's continue this idea of assessing vulnerability related to climate impacts on health. So understanding the current situation means being at scale in space and time. So this is just an example of a review article which looked at how various vulnerabilities are computed. So here is vulnerability to malaria in Tanzania circa 2010. So you can see the scale at which high and low vulnerabilities, regions and districts and water bodies are mapped. This is an example of socio-climatic vulnerability index for Brazil circa 2010. Hatching indicates regions where climate projections related uncertainty is high. Okay, so we are worrying about current situation and we want to quantify vulnerability, which is for health, but it also obviously depends on socio-climatic vulnerabilities, and the future projections need to be considered along with their uncertainties when we want to make health projections. This is very critical as well. This is physical vulnerability of the elderly to potential storm surge in Sarasota County circa 2010. Again, various spatial scales and age groups here. Elderly exposure to potential storm surge, which is always critical part of the vulnerability assessment, is to look at geographical location, age structure, access to various shelters, health care facilities, and so on. Finally, this is socio-spatial flood vulnerability in England. So this is socio-spatial flood vulnerability with extremely high to extremely low, and again you can see the scales at which these are mapped. So the spatial scales which we have seen before at city level, for example, in terms of projecting vulnerability to heat waves, these are critical. Only then you can come up with effective plans, right? So vulnerability to climate sensitive health outcomes by subpopulations. So even within the population you have to have resolved the scales to map vulnerability properly. So groups with increased vulnerability include infants and children, pregnant women, elderly people and people with chronic medical conditions, impoverished and low socioeconomic status, and outdoor workers who are always exposed to the weather elements, right, and extremes. Climate-related vulnerabilities for these subgroups range from heat stress, ozone air pollution, waterborne and foodborne illnesses, vector-borne diseases, malnutrition, what else? Air pollution we talked about. So basically there is lots of overlapping, and for outdoor workers ultraviolet light, UV light exposure is specifically included as opposed to the other groups which are not more specifically exposed to those, right? So these are the kind of factors that need to go into the vulnerability computations. To assess the capacity and performance of current programs as part of the understanding the current vulnerability map, the following kinds of questions are relevant as proposed by the World Health Organization. What is the management structure for the program? This information is necessary to identify constraints and opportunities for modifying the program. What human and financial resources are available? Cataloging these assets is important when planning additional policies and programs. How effective is the program in controlling the current health burden? Less than optimal effectiveness may be the result of limited human and financial resources, always, limited laboratory and material supplies, limited coordination among partners, administrative inefficiencies, and other factors. Addressing this question should include evaluations of overall effectiveness, particularly of programs serving vulnerable populations and regions. So seem obvious, but nonetheless, as part of the evaluation of current situation, those are critical to be ticked off. How robust are core health systems functions, such as human resource planning, disease surveillance, and emergency preparedness and response? 2. Extreme weather events. This is important for identifying existing gaps that may be exacerbated by a more variable climate. So if you want to worry about health vulnerability assessments under climate change projections, you need to have these baselines evaluated and gaps identified. How might proposed changes to the program in the next 5 to 10 years affect its ability to address relevant climate sensitive health outcomes? So obviously these will become very region specific and location specific, neighborhood specific as well. And this leads to understanding future impacts of health. We have looked at this figure as well before, and again, while this is a good motherhood statement in terms of the climate variables like rising temperatures, more extreme weather, rising sea levels, increasing CO2 levels, affecting various health factors like air pollution, changes in vector ecology, allergies, water quality, food supply, environmental degradation, extreme heat and severe weather, leading to health outcomes in asthma, cardiovascular diseases, various diseases that we looked at, vector-borne respiratory allergies, asthma, waterborne diseases, food-related, food security, quantity, quality, utilization effects, forced migrations, conflicts, and mental health impacts we talked about, and so on. But we have to come back again to vulnerability, risk, and at scale, and at subpopulation level. So while this kind of a map helps, we need to then go back to scale. So identifying and prioritizing health adaptation measures then comes down to building a climate resilient health system with foundations, information, and risk management. So those are again broad statements, but still important to look at various things under foundations. You have health governance, policy and management, cross-sectoral collaborations and partnerships, capacity development. Under information, you have vulnerability, capacity and adaptation assessment, which is what we are talking about. Integrated monitoring and early warning systems, we talked about that in the last chapter. Research that is needed, communication and community mobilization, which is always critical to have the system work appropriately, because they have to be part of the building of the system. Under risk management, we have climate smart health programming, cross-sectoral prevention and risk management, and emergency preparedness and management. Okay, so the next step is to evaluate the identified policies and programs to determine which measures are practical for a particular situation within existing technological, financial, and human capital constraints. Even though you may have a very good idea of how vulnerable the community is at scale, at every scale, and how vulnerable it will be in the future, eventually technological, financial, and human capital constraints are going to determine how resilient you are going to be. This step generates a list of policies and programs from which policy makers and decision makers can choose. Criteria that can be used to determine which choices are practical given these constraints include the following. Technical feasibility. Is the choice technically viable and available? For example, although a possible program to address potential changes in the geographical range of malaria is vaccination, this option is not currently available. There is no effective malaria vaccination right now. Right? This is why more than a couple of million people get infected, and many million die from malaria. Operational feasibility. Does the health system have an adequate workforce, sustainable financial resources, service delivery mechanisms, and technical knowledge and capacity to deliver intervention or programs? Okay, very critical question. Degree of effectiveness. How effective is the proposed policy or program in reducing the incidence of the adverse health outcome? For example, not all malaria prophylactics, curative solutions, medications are effective in all regions because of the development of drug-resistant malaria. There's a handicap there. Economic efficiency. How costly is the policy or program in relation to the expected benefits, and who would be expected to bear the cost? Environmental, social, and legal acceptability. Does the proposed policy or program have environmental consequences that are unacceptable, contravene current regulations, or likely to conflict with the laws and social customs of the affected population? So the last mile problem, where the rubber meets the road and so on, socio-economic, cultural, and other social science issues become very critical. It's not just a pure medical science or a climate science problem. It's not an epidemiology problem. It includes other social factors that have to be dealt with. Okay? And future projections also must consider these sorts of things, where you get projections of surface temperature for various scenarios from the IPCC projections, but you need to have region-specific quantifications of uncertainties. Here, for example, degrees warmer compared to the baseline and certainty are mapped. There is high certainty in some regions. There is low certainty in some other regions. Okay, so whenever we are looking at the future, this is from 1981 to 2010 to 2071 to 2100. So worrying about future vulnerabilities in terms of climate change projections is going to be tricky. Imagine that this is temperature which has much less uncertainty than precipitation projections. So making these sorts of uncertainty maps for precipitation is going to be even harder. And then there are sea level rise, storm surge, extreme events, humidity, and so on and so forth. So all those have to be mapped to translate to health vulnerabilities. Finally, some measures of climate mitigation may in fact turn out to be negative for health vulnerabilities. In other words, may end up exacerbating health vulnerabilities. For example, water stress is expected in many places. Jordan is an example where treatment of wastewater to be used for irrigation is in practice. It's there in many places, and it's a good idea, right? So you take wastewater, you use various technologies that are well tested, like constructed wetlands, and do the various filtrations and make it ready for irrigation, to be reused for irrigation. But if this is not done very carefully and monitored and evaluated, you may end up creating contaminated food, which is going to make health outcome much worse. It's going to exacerbate health vulnerability. So these kind of systems that require reuse of water or saving water and so on, or growing food under certain conditions, all need to be evaluated for health outcomes as well, especially going into the future. Okay, so that's a short introduction to climate and health vulnerability assessments. I hope you get a sense of all the details that are involved. This is of course just an introduction to the problem. When you want to actually compute vulnerability, it's very much a region-specific local metric, and all the actions, policies, etc. also have to be sensitive to this region specificity of the metric, and measures, assessments and evaluations have to happen at those levels as well, in a non-stationary kind of way where people are moving in and out. Systems are changing, governance systems, water quality, water availability, food quality, food security, food availability, nutrition, demographics, age structure, and so on and so forth. So very complicated, but we need to have a good map of what are all the critical factors.